Mimi naitwa Ronald Sandro Sunguti, chairman wa Interreligious Council of Kenya, ambayo inahusisha madhehebu yote yenye yako within Central Rift. Na kulingana na mada ya siku ya leo ambayo tunaadhimisha siku hii ya leo, tunaona kuwa tuendelee kushirikisha vijana, sio ati kwa sababu watu wazee ama watu wa umri wameshindwa, lakini tumeonelea ndio tuweze kufight, ndio tuweze kufaulu, inahitaji hata watoto hata na wakongwe pia. But ni kwa sababu tunaona kuwa generation yenye tunayo sahii ya vijana ni wengi, na wao wakiamua kitu wana nguvu nyingi, ni wengi, wana nguvu na tena wamesoma na tena wanaweza tumia njia zozote kama za saa hizi za social media and so on. So inawezekana, that's why tumewaita ili tuweze kushirikiana pamoja. Another thing is that we as a church tumeonelea kuwa tuweze kupiga kelele, kwa sababu normally kanisa huwa haipigi kelele, kwa tunafanya vitu kwa utaratibu. For example, very many times tumeengage these leaders in closed door meetings tukiwaambia kuwa hii kitu sio mzuri, tufanye hivi. Lakini ukiona watu wanapiga kelele saa hii hata mpaka pesa zinarudi, tumechoka, because nobody is taking the initiative that we have been engaging. So that's why tumeonelea kuwa we stand on our rooftops tuseme kuwa enough is enough. And that's why you'll find out that saa hizi hata ukiangalia most of the leaders wengine sasa wameanza kuficha, hawataonekana in the open, and we want everybody to take responsibility. Another thing is that tungelitaka saa hizi, a health nation is a rich nation, lakini saa hizi ukiangalia our nation is sick because very many institutions, health institutions hazifanyi kazi vizuri, and I find out that now kama hazifanyi kazi vizuri, we are going to have a sick nation, and a sick nation cannot be development conscious. It cannot develop. When you find people who are very sick, you find out that hata shuleni pesa, unajua ugonjwa is very expensive, itamaliza kila kitu. Just take an example of somebody suffering from cancer peke yake, watauza everything. So that's why we are saying instead hata hizi pesa zenye zinamwagwa kwa makanisa, why can't they renovate? 5 million can renovate a very good health institution. 5 million ya mara moja, na hiyo ni siku moja, inaweza weka madawa mengi katika hospitali zetu. So that's why we say badala ya kusaidia mtu mmoja, let us help the whole nation. Badala ya kunipea mimi kama kanisa yangu shilingi milioni fulani, why can't we channel it to the right place? And that's why tunasema tuweze kushikana mkono, and everybody with the media, na nyinyi pia msiwe maybe mna take the positive sides, na hizo msiweke kwa ziwe zinasikika sana. Asante sana.
So my name is Bishop Peter Mwiruri. I'm the chairman of NCCK Nakuru County and also the chair of the region, that is the South Rift, ambayo inashikia kutoka upande wa Bomet, Kericho, Narok na Nakuru na Baringo na Samburu. Siku ya leo tulikuwa tumekutana hapa kwa sababu hii ni siku ambayo we are calling it, we are fighting about the corruption that has been there in this country and all of it. And as a church and the religious leaders and other members, and being supported behind by other organization, we are here to tell the country that this advice that we need to fight, all of us collectively. It's not only for the church, but the church is there to fight because we need a better country. Because with corruption, we shall not have a good country. With corruption, everything in terms of, like today, our theme is based on about health. The health sector has collapsed, and this has been brought about because of the corruption. We are telling everybody to stand, not only the youth that we are with, but church together with the community, to make sure that we have a Kenya that we want. Corruption is fighting back, and this is a menace. You may be looking for where we are people have become poor. So when they become poor, they look for ways how they can be able to get the means of living. So somebody is engaged in corruption because of that. But we are saying if you can be empowered economically, socially, spiritually, we can move and we can have a Kenya that we look forward. And as we celebrate today, we are here to tell Kenyans, let us stop this menace, because together we can. Together we can move together. because let it not be only for people. It's not only for others who are just talking, but let's today be not talking, but action, the talks that we are talking.
My name is Brian Kibira from Transparency International, Kenya, and also representing the consortium partners, that is AMWIK, Association of Media Women in Kenya, as well as the Global Compact Network and Inter-Religious Council of Kenya, who are consortium partners implementing these USAWA projects, which seeks to unite societies against fraud, waste and abuse in the health sector. So you've asked a very good question as to why the youth, and ni kama the youth wamechoka. I wouldn't want to really say so, but we'd say that the youth have borne the brunt of discrimination when it comes to corruption. And you find that they fall amongst the cadre of the most affected people with corruption. More so when you find that they're the majority of the population, yet they're categorized also as being among the marginalized groups. So you find that corruption affects them in a very special way, and it is personal to them. And that is why we are here to speak to them. So some of them have seen this corruption persisting for decades, and there is that growing wariness amongst them, as well as apathy. And that is why we are here to also build their capacities, because information is power. And once we have this information, and once we have empowered them, we can be able to partner together and work together, because we agree that no man is an island, we have to partner. So that is why we are here today in Nakuru, to be able to commemorate this day with them, have conversations with them, and see how we can build the future towards improving health service delivery in Nakuru through addressing corruption. There is no definite right or wrong answer to it. I believe in surveys that have been done by the EACC, when asked the same questions, there is a growing amount of Kenyans that feel that we are not headed in the right direction. But at the same time, there are gains that we are making towards addressing corruption. I believe it's only earlier this year that we saw even the youth standing up and saying that we need to address this corruption, and the youth are ready to stand up. So we are capitalizing on that strength, that indeed there is a movement that is there, and we are there as partners to be able to work together to address corruption. So I'd say that corruption, yes, is there. There's a lot of work that needs to be done, and there are people who are ready to stand up and say that we are ready to fight corruption as well.
First and foremost, my name is Paul Masese, the Chief Executive Officer of the Center for Enhancing Democracy and Good Governance, and I'm also the convener of Nakuru Civil Society Forum. To reiterate, today is indeed an important day. Remember, this is a global day, yeah, that is marked worldwide by the UN. We have an African Commission Day, corruption as well, so that to put it in perspective, corruption is not an ill confined to Kenya. Corruption is all over the place. That's why we have legal frameworks to address corruption properly. Our case is perhaps unique in the sense that our economics are doing so bad, yet and we have very good laws, we have institutions to fight corruption, but corruption continues to increase by day. None other than the former president, who said that every day we lose 2 billion. Just recently, the Kenya Association of Manufacturers upgraded that figure to around 3 billion. So think of it in terms of service delivery. If we lose 2 billion a day in 1 year, it means we are losing 2 multiplied by 364. That translates to 728 billion. The transfer to county by Treasury this year, according to the Division of the Revenue Act, is 380 billion. So it means 728 billion is twice as much is almost twice as much as has been transferred to counties. So in other words, corruption robs us money that we can transfer to counties for 2 years. So if we were to spend the 2 billion per year, how many level 4 hospitals would we build? An average of fully equipped level 4 hospital would cost up to around 500 to 700 million. Okay, say 1 billion. So we are losing a hospital per day. That's what it means. And that's why it's urgent and necessary that we unite against corruption. The unfortunate part is that our kind of corruption appears motivated by the leadership. that we have in place. So that's we cannot therefore divorce corruption from leadership. And my call to leaders, to my fellow citizens, is that we really need to be woke. Marching forward to 2027, we must begin to ensure that people with a record of corruption, abuse, and misuse of public resources do not make it to any position of leadership.
My name is Lona Sempele, and I'm the program coordinator of the Association of Media Women in Kenya in this USAWA program. We are very, very happy to be here as the fourth estate, just to also give a contribute in terms of this discussion with regards to corruption, because corruption, as we have heard from all those who have spoken before me, is destroying this nation if we do not stop it. And the media also has a role to play in letting citizens know just how much corruption is taking place. For example, if we are talking about Nakuru County, how much money is going to the health sector in Nakuru County from national government, from the county pockets itself, the docket, from donors, from user fees, and maybe from borrowings. And then when that money is sent to the county, how much is actually used for development and how much is used for recurrent fees. So recurrent expenditure. So you see, we need to educate ourselves as media when we are reporting about health, because it's the second most corrupt function in this country as we've had today. And this is affecting what drugs people get in hospitals, whether they can get a bed to sleep on, whether they are able to pay through their SHIF or NHIF, whether they are able to drive to a hospital because there's a road that was actually supposed to have been built to that hospital. It affects all of us in terms of health. And the youth most especially, because we've heard that the youth make up at least 65% of our population. And yet they make up 67% of those who are unemployed. So you can see, how will they buy their drugs? How will they enjoy their health services? So the media is the one that must educate the citizen, and not only radio, TV, and print, but even new media options, the creatives, the singers, the dramatists, the spoken word artists, bloggers, vloggers. They have a role to play to let the citizen know his rights, her rights in terms of health. They have a role to play in terms of pushing for good governance, leadership, commodities management, and service provision in health. They have a role to play in letting citizens know which laws and policies apply to health. So there's a very important role for media and new media to play in agitating for no corruption in the health sector.